So what we have here is the Samaritan's Purse Emergency Field Hospital Alternate Care Site. This was originally developed to be deployed in a developing country situation where there was a need for emergency medical care. But as the global pandemic with COVID-19 ravaged the world, we were able to adjust and adapt our emergency field hospital for use in first world countries. The system is designed to be lightweight, portable, and able to be deployed very quickly. But originally it was set up to operate as an independent hospital. When we began to use this model in the first world, in places like Italy and in New York City or Southern California, we realized that we had to modify it so that it could work as part of a sophisticated existing healthcare system. So what we have in fact developed then is an alternate care site that can quickly be deployed to add additional capacity in a first world scenario to the existing medical facilities to deal with surges in COVID cases. A few months ago, I was contacted by the Seoul municipal government to see whether or not Samaritan's Purse might be able to help here with the surge in COVID cases. So we looked at the systems that we had used in the US, in New York and in Los Angeles and in a couple of other places there to see if we could bring that here to add that capacity here if needed. The Seoul Metropolitan Government, working with Korea University and others, had some other plans for different kinds of modular healthcare systems that they would use to expand the capacity here. And they wanted to have an educational seminar where we could compare these ideas and perhaps learn from each other and develop a system that could be used here. So we were able to work with local vendors to secure the tents and some of the other infrastructure, but then we shipped over the medical equipment that goes inside this from the US, from our US headquarters, and put all of this together for the seminar today. We had a day yesterday of lectures and questions and comparing ideas so that we could see what else we could learn from each other. And today we've had tours of an actual setup of the system like we deployed in New York City to show exactly how all that would work using the system that we've developed at Samaritan's Purse. So the expectation now is based on this and what we've learned, we will continue to work with the Seoul Metropolitan Government and local healthcare systems to respond locally to COVID in the way that's most appropriate based on the capacity that's needed and the current situation with the disease.